Now to the ongoing health crisis in the country. With the nurses and clinical officers strike entering day 24, doctors continue to call upon both levels of government to reach an agreement to end the stalemate. Health Principal Secretary Susan Mochache has stated that all health workers are equal in the eyes of the government. However, the government can only resolve grievances that are COVID-19 related and not others to do with salaries and promotions. The national government is positive that there is good progress in the negotiation, which could mean that nurses and clinical officers could soon resume duty.
The Marigat Sub-County Hospital in Baringo is but another hospital that has been shut down owing to the persisting nurses and clinical officers strike. But to truly understand what this picture of desertion means when healthcare workers down to their tools, you will have to walk a mile in David Mulo's shoes. He brought his sick wife here, who is ailing from acute diarrhea and vomiting. Unaware of the closure, not even the pharmacy is open. They ponder their next move. And moments later, they head to a private health facility to seek medical attention. Miles away,
Gharama ya kukuja kwa private hata sijajua ni shilingi ngapi sababu daktari hajaamua. Kama ni 1,000, kama ni 2,000, sijui sasa kwa hapo.
Miles away, Margaret Koroito nurses her teenage son, a class 6 pupil, who is diabetic and had become blind owing to high blood sugar levels damaging the back of his eyes, which were left undiagnosed and untreated. Her son has not received treatment in the last 2 months. She moved from Kiserian, 30 kilometers away, to rent a house in Marigat in order to be close to the sub-county hospital, whose doors remain closed.
Daktari kienda strike, mimi nimekosa kitu ya kusaidiwa nayo ukipeleka hospitali kupima sukari na hiyo fresha.
To increase his sugar levels, she gives him sweets. Treatment at private health facilities comes at a very steep cost. For a basic service at triage, such as measuring blood pressure, costs 100 shillings. The cost of drugs would be much cheaper in public health facilities.
Anasema 1,000 au 3,000, mara ingine 600, iko moja dawa ni tofauti. Na unajua ni biashara, private ni biashara tu.
Serikali ingekuwa wazi, wangeokoa watu kama hawa ambao hawezi wakaweza kupata pesa wapewe huduma.
Patients in Baringo are now resorting to seek healthcare as far as Eldoret at the Moi Teaching and Referral Hospital.
Nikaenda hospitali ya Marigat, nikaenda Kabarnet, nikaenda Eldoret na nilikuja kuulizana hospitali bado haijafunguliwa.
In Bungoma, operations at the Bungoma County Referral Hospital and other health facilities across the county's 9 constituencies are slowly gearing towards normalcy. Healthcare workers also offering services at the county's COVID-19 isolation center in Webuye. However, doctors still maintain that without the nurses and clinical officers, the service delivery is severely impacted.
Ameshughulikiwa na sijalipa chochote.
Tumerudi kazini, ijapokuwa madaktari hawezi fanya kazi peke yao, lazima wanahitaji wauguzi na wale wa madaktari wa kliniki.
Nurses and clinical officers have accused both levels of government of giving preferential treatment to doctors at their expense, a matter the Principal Secretary, Ministry of Health Susan Mochache, has refuted, maintaining that the national government is committed to negotiation, although not all their demands can be met at this time.
All health workers equal. And in fact, some of them are COVID-related. Insurance for the health workers. We have tried to dissuade them that this is a wrong time to begin going on to CBA issues. And I have no doubt that in the coming days, we will finalize the return to work formula.
With the government citing good progress, the return to work for nurses and clinical officers is a matter of extreme urgency, particularly for patients who can no longer afford to wait. Dorcas Wangira, Citizen TV, Nairobi.